to click record. So now we're recording. And no, I don't want you to do that all over again. Welcome, everybody. You just
We don't
tuned
have time.
in. I think you've more or less covered this, right, Karen? Or
I think, yeah, I guess I did. I don't need these slides.
yeah. I think maybe some key things here is that when we're thinking about what the governor is thinking about going into this budget, the tax receipts are down. That means state revenue is low. That can mean and revenue, that's how much money we have to spend on important investments and resources. And going into this, we knew that that the governor was one committed to not raising tax revenue, and had told her state agencies to anticipate flat budgets and even encourage cost savings. That's all very important context because despite that reality, we did in the youth mental health side and some of our other pieces around young people, we're actually able to advocate for investments, new investments, and that's no easy feat. There's some parts of the advocacy world that are facing cuts and things like that. So that just goes to show the sort of special position we're in. And let me dive into that a little bit. I made this very Ian's looking this like Ian, let's make a better version of this at some point. But I made a picture here because I was just struck by this event. Uh, Governor Hochul standing on a podium that says tackling the youth mental health crisis and saying this incredible quote that I don't think we've seen a governor, at least in my 11 years, committed to youth mental health and mental health in general in this really big way. For decades, oops, for decades, our mental health system was deprioritized and defunded. And make no mistake, this is the defining challenge of our time. That's a good quote to have in your pocket as you go into meetings, as you speak to government representatives, you go to the media, is that there's a huge commitment. And she's absolutely right. I mean, just look at this chart. This is just the cost of living adjustments that haven't happened since 2006. This space here between red and blue accounts for nearly $500 million that has not gone into our behavioral health system. And when we talk about things like access and turnover and people leaving the field, and families experiencing wait lists for services, just keep in mind that there should be $500 million that should be present in the system, but the state right has deferred from adding cost of living adjustments to these human service contracts. This is money missing from the field that should be here. We keep all that in mind. When she's talking about decades of disinvestment, this is what she's talking about. So to sort of illustrate the point, no, we're not going to cover all this, but you'll have access to this information when we send the slides out. Here are some of the things that we're talking about when we say the governor did make some substantial investments and commitments to systems change when it comes to youth behavioral health. Things like the cost of living adjustment, 4 million or just only 1.5. We need more. We'll get into that. $4 million in loan repayment for children's mental health professionals. That was explicitly in our priorities going into this session. Teen mental health first aid, black teams, and then some more, and we'll get into it. But this is just to illustrate there's some big commitments here, and we have to be we can express some gratitude for this, for what she's committed to doing so far. But I think to really live up to that quote and the commitment she's made to re sort of or transform the continuum of care in mental health space. There's way more that she can do, and we got some ideas. Here's a few other pieces around youth justice and family well-being. I kind of looped these together, but things like anti-poverty initiatives, money for juvenile detention and diversion and prevention dollars. There was some increases. Um, and some investments in maternal mental health and well-being, all good stuff. But let's get into what we're going to be. That's a kind of an overview of some of the things that we're seeing. These are positive. Let's build on them. And Karen, I'll pass back to you to talk about
Yeah,
our priorities going into this year.
sure. And feel free to jump in because Brad and I really work hand in glove every single day. We see a lot of each other, hear a lot of each other's voices all the time. So with regard to the workforce and our kind of tagline, workforce, not wait lists, we have been in conjunction with the Healthy Minds, Healthy Kids coalition that we've been working with for a couple of years now, been calling to and attempting to advance a really substantial investment into clinics serving children through a rate adjustment. It's a $195 million initiative, which would impact CFTSS, HCBS, and Article 31 and 32 clinics. Strategically, we've been attacking this really on several levels. We had initially called for the governor to include it in her executive budget proposal. We did a release of the study on the rates. We had a press conference, we had op-eds, we had meetings, and unfortunately, she did not include it as one of her priorities. So we have now pivoted to working with the legislature nonstop, though it's probably a long shot because it's a lot of money to be had at the legislative level, and they would have to shift around other priorities. But we are doing meetings nonstop, both in long form. The other day, Brad was in long meetings, and I was over at the Assembly and Senate pulling members off the floor while he was meeting with staff people. I mean, we are really saturating the Capitol with this messaging and all of our messaging, really. We have a strong media presence on this issue and an upcoming lobby day, February 12th, is that right? February 12th,
Yeah,
seems.
February
There's so many
12th,
lobby
Healthy Minds,
days
Healthy
right now.
Kids. Yep,
Yeah,
they're
yeah,
coming. And then, of course, like we're queuing everyone up for March 19th. We're going to have a last say on what gets included in the final budget.
absolutely. Again, work that we've been doing in concert with an advocacy coalition, the behavioral health advocates. Every Wednesday, we've been meeting for several years now. Last year, we were successful in getting a 4.5% COLA. We had asked for 8%. Governor only put in 2%, so we had to move that needle up to 4.5%. This year, we asked for 3.2%, which is indexed to the cost of living. And she put 1.5. So you see how the game is played here in Albany, right? I mean, maybe we should have asked for 6 and she would have landed at 3.2. Hard to tell. So we are working, we have a press conference next week, February 5th, Monday, on this, calling on the legislature to make sure that the final enacted budget has a 3.2% COLA for those working in impacted agencies and contracted by impacted agencies. I was going to add one more thing to that, and now I forgot what I was going to say. So, and then of course there are a number of initiatives that are embedded in her executive budget proposal around investments in tuition assistance and expansion of loan forgiveness programs. Particularly those who are willing to serve children and adolescents. So I know that we'll be supporting that at Families Together, the coalition, and a number of other provider groups that are serving these kids are also very engaged in the commitment to move this.
Thanks, Karen.
Yeah.
And just reiterating this simple idea that if we make investments in the workforce, we help them get paid better, we help staff up and make sure there's more professionals and peers and all the different people who serve in this system. The waitlist crisis that we hear consistently from families and from clinics and providers could be alleviated. This is a big part of it. And then thinking long term about how do we draw new people into the field through loan forgiveness and other sorts of strategies. So all these things are trying to get at that simple idea: workforce, not wait lists. I'll quickly cover this slide, Karen, just to dive in a little bit deeper into the rate study, because this is one of the key things that we're pushing for this year, and we really do think could really be transformative as families are dealing with this crunch and running into this wall trying to access services. We went bold. We did a rate study. We pulled together a group of 30 people, many of them young people, youth peer advocates, family peer advocates, and other clinicians. Really smart minds across New York State to develop this rate reform proposal. And some of the basic things it does is basically adds a COLA for inflation. It recognizes that there are many different types of care management and care coordination entities that someone working with families has to coordinate with, and so adds a fee to kind of pay for that currently uncompensated time. And then it adjusts children's clinic rates to reflect the extra effort that goes into serving families and children. You see this index here, the family is in the middle, and all these different systems that a clinician or a family or youth peer advocate has to navigate and coordinate with. That work is often not paid for or reflected in rates, and we think it ought to be. And we think that would make a huge difference in the way that our programs are able to function. And then lastly, and this is also very important, we're not just talking about clinics. We're talking about CFTSS, that's Child and Family Treatment and Support Services, which is the Medicaid billable where family peer support and youth peer support can be billed to Medicaid, HCBS, home community-based services, and clinics. So really thinking community-based, outpatient, that array, that part of the system desperately needs more investment. And so that's what we're talking about when we're talking about the rate reform, the Healthy Minds, Healthy Kids rate reform, which again is $195 million. Cheryl, I'll pass to you quick, talk about some of our peer specific asks. I left something in I wasn't supposed to.
No, I am here. Robert, I'm sorry, I apologize. Someone keeps ringing my doorbell and I don't know who it is, so I apologize for that.
You want me to take it?
No, it's two men. I
Okay.
don't know. Yes, okay. Our ask is to add at least 5.5 million to the state aid, which are the 1650 programs, which are the family support programs for expansion of family and youth peer support. We're asking them to match the current peer rates in all settings for recently enhanced motors. Now, the motors are mental health outpatient treatment programs. Brad, did you want to continue?
Yeah, thanks, Cheryl. And just to reiterate, this 1650 money for those who maybe don't know what that means, this is state aid dollars that's really been around since the beginning of family peer support in New York State. It's been flat for well over a decade, flat meaning that it hasn't seen any increases. But it's flexible state aid dollars. It's not connected to Medicaid. And it allows counties to enter contracts with family peer support providers and others that are doing youth peer support to really open up, keep things simple, really focus on what they think their communities need, and not necessarily be tethered to one-on-one meetings, but really thinking very flexibly, just like families need, really. So we want to expand that funding, and $5.5 million, certainly we could argue to double it. So the thing is around $10-12 million, but we think $5.5 million is more than reasonable. And then with the current peer rates and motors, we totally recognize that peers working in clinics, that's what we're talking about when we say motors clinics rate, are need to be paid better. That's what we've been saying for years now. The rates are just too low, and it results in low wages and lack of benefits for people working as peers. But we think that that same logic should apply to everywhere where peers work, and that's what Cheryl was just talking about. So match the current rates to Mahoters, which is as close to as high as 150% higher in Motors clinics than in other settings. That's just not right. We think that that should be matched across the board, everywhere where peers work.
Right, and Brad, I just wanted to add as peers, because we all worked as peers before, and I've worked as a peer, and we do know that we normally do more work and we're paid less. So for us to be matched with the clinics, the Article 31 clinics, It's what we're asking for, which is only fair.
Absolutely. Thanks, Cheryl. Karen,
Yeah, up again. So we have also, in addition to everything else that we've told you about today, we've been working to advance a number of initiatives that would really try to hold the insurance industry's feet to the fire. You know, Paige and I, this is my 23rd session. And when I met Paige, we were working back then and really cut our teeth. The biggest piece of legislation I think either of us had worked on at that point was Timothy's Law. And ever since then, the insurance industry has continued to try to skirt their requirements to pay for mental health benefits. A couple of years ago, you may remember that we took a look at, there were 6 plans that were brought up on non-compliance charges from the Attorney General's office, and we weeded through those settlements and picked out the themes, and we created the insurance reporting bill, which has helped us a lot in the context of what we're working on now. It's helped us to kind of tease out some of these details that we're still seeing gaps in. And so one of them being the rates, constantly a battle around the rates, and we're working to require commercial insurance to pay at least the Medicaid APG rates for behavioral health. Now, in what universe is Medicaid the payer of choice? Only in behavioral health is Medicaid paying better than commercial insurance. We're working to improve network adequacy regulations. The regulations now, you may remember if you were on these calls last year, this piece is an outgrowth of our work last year that we actually led to require DFS and DOH to promulgate regulations so that we would have adequate networks. We worked with them over the summer and various providers to help them shape what they were focused on. And now we're seeing the regs just came out last week. There'll be a 60-day comment period, which we will be engaging in an attempt to get this right once and for all. We've also been working with, in concert with a number of our coalition partners from the Behavioral Health Advocacy Group and some from the Healthy Minds, Healthy Kids group, to ask for a carve out of behavioral health for Medicaid managed care. After the MRT did its work, Medicaid redesign team did its work years ago, there was a decision to move behavioral health and move most services under Medicaid managed care, although pharmacy has come in and out many times throughout this process. And one of our colleagues has been really mapping this out with unbelievable detail and looking at all of the citations for the 14 plans that are included in the Medicaid managed care program. And not one of them has been found to be in compliance. And so what she has really led the charge and included all of us to help with this process is calling for just carving out behavioral health from this quagmire. The governor did not go in that direction, unfortunately. She did address the issue, and instead of carving it out, she's calling for a procurement system instead. Now, I don't think that that has a snowball's chance in hell of passing, because there's no way that in an election year, the insurance industry is going to go for having to reapply and go through a procurement process. But this is going to be a battle that leaves a lot of people bloody on the field, I think. Making telehealth payment parity permanent. Again, very proud. This was, we led the charge 2 years ago. I'm leading the charge for Families Together and the Psychiatric Association. And as a negotiator on this one, we were able to secure it but for only 2 years. They put a sunset. They wanted to take a look at the rates of utilization and if it was working and are there any problems. There was a recent report that was released that supports, particularly in mental health and substance use visits, are the highest utilizers, with primary care coming in second. The governor, while we asked them to make it permanent in our discussions, she put a 1-year extender in her executive budget proposal. That was a bit of a disappointment. It's very disruptive. The plans are champing at the bit to end this process because the utilization is higher with it. So they've already started sending letters out to a number of to their plan holders to say that this will be over on April 1st. So we challenge them there. And then also some of the provisions that the governor did include in her executive budget proposal that we're very supportive of, and we will be working off the floors of both houses to make sure stays in, is that's really ramping up an enforcement of behavioral health parity fines, doubling the fines for non-compliance. So there we have it, Brad.
Thanks, Karen. Really appreciate that. I'll highlight some of the pieces here. We know that from the families we talk to every day, that the front lines of the children's behavioral health crisis, youth mental health crisis, is often the schools, where young people spend a huge majority of their time for a huge majority of the year. Some of the things that we're eyeing are building off of good things that were started in the past couple of years. One is this grant program called Student Mental Health Support Grants to School Districts, which is $50 million spread out over 5 years. And it only applies to a small number, just under 30 school districts, although there are 280 school districts eligible. So we looked at that and said, and we talked to some of the schools, and there are good things happening. There's only about 26 to 28 school districts that are currently involved in this program. We think that needs to double as a start. And I think we need to start a new cohort of schools. Like we said, there was 280 eligible. There was many more that applied who did not receive this funding. So we want to see investments in that expand. We do support the governor's initiative to establish school-based mental health clinics in every school that wants one. That's their metric. I would push back and say schools that need one. And part of that is the work, once we get these sorts of things passed, thinking in your own district, thinking in your own school district, what can I do to advocate to make sure our schools take advantage of these things, like startup funds for clinics, maintaining and taking advantage and building up their school-based mental health clinics. If you don't have one, starting one, right? We also want to expand this community schools model, which brings in all the various community providers for things beyond just mental health, really anything around poverty, around housing supports. There's a litany of community programs out there that want to help support students achieve their education, want to help support their families. And that's the beauty of this community schools model, is wraps those things around and sort of brings the community in and be a part of the education of these young people. But they want to expand that. And then lastly, of course, we've just been talking about budget stuff. But I know that there is just a massive amount of support in our network for the Solutions Not Suspensions Act. And I see Angel Gray that you're on. Thanks for being a comrade with me in this fight. We're trying to make sure that young people K through 3 can stay in school. Kids who violate dress codes can't be suspended for subjective things like insubordination or talking back, essentially. That we find that schools are pressed upon to find solutions and not react to the behaviors that young people exhibit, often because of trauma and stress and other things, and help support them, right? Keep them in the classroom, because once a young person is suspended from school, they go on a different trajectory. There's tons of evidence that supports that. So we need to keep our young people in the classroom, and that's what the Solutions Not Suspensions Act does, or would do. I'm going to move forward. So that's our mental health, our mental health part of the agenda of our policy priorities. I want to put out a poll very quickly, though, that asks this question: have you or someone you know experienced wait lists for youth mental health services? So why don't you guys jump in? Let me know if you've ever heard of such a thing. I know you guys can't see the answers right now, but I think you know how this is going to go shake out. So I'll stop it now, end the poll, share results. Exactly. This is a not very scientific poll, but this is a widespread issue. We've heard from service providers from across the state that they are maintaining wait lists, whether they admit that publicly or not, in the hundreds to 200s. Some of these programs, and it's not right. Families and young people need services now. That's the problem we're trying to solve, and that means investment. So I'll stop sharing. There's other parts of our work that we're focused on, not just mental health, but thinking about the overall well-being of families that in our communities, and thinking also about this idea of the hierarchy of needs. You've heard of that idea, the Maslow's hierarchy of needs, and at the base of it is, do you have your basic needs met? Before you get to this point of finding out who you are, do you have food? Do you have housing? Do you have income? Are you safe? Are you healthy? These are key parts of a young person's development. And so we're calling, or the theme here is simple. We want to fight poverty, not the poor. We want to invest in the basic needs that young people have and to improve the conditions where families are raising their children. The simple idea has been proven time and time again. There's a mental health risk. Living in poverty undermines well-being. It's a simple idea, and we think we need to throw a life raft out to people that are struggling in through economic hardship. And so this is a snapshot of our platform for reducing child poverty in New York State. We're part of a campaign called New York Can End Child Poverty, doing some really great work on that front. We just joined it about a year and a half ago. But it's calling for things like giving people simple things like child tax credits, improving that, making sure that there's wider eligibility, especially for poorer families, and expanding income tax credits, making sure we have childcare universally and that it's affordable and not a huge burden on families who are trying to enter the workforce and provide for their families. The Child and Family Well-Being Fund, funding communities, providers, and associations and small grassroots nonprofits who are doing the good work but are not sophisticated enough as a nonprofit agency. Maybe they don't have a tax code. How do they get funding? How do they plug in? Then these are often the programs the communities trust and know and go to. So how do we take state dollars and get them to that level and be thinking about, and let's first, if we're going to do this, let's first target families at the highest zip codes with the highest level of child poverty and child welfare involvement. We're also looking at things like housing. A key part of mental health is feeling safe and secure. And how can you do that if you are housing insecure and you don't know where you're going to be living in the next week? Things like housing access voucher program, that's $250 million we're calling for a new voucher program for people who are at risk of homelessness or currently experiencing homelessness. The child welfare housing subsidy, we changed last year from around $300. We almost doubled that to $725 a month for young people who are leaving the foster care system, and for families that are currently involved in the child welfare system, save from preventative dollars. And then also expanding public assistance for housing. We're talking about universal school meals, making sure that any young person who needs free or is eligible for free breakfast and lunch can access that. That means making sure that school districts, even those that are school districts that are well off, are offering this to young people. And then this is a very big thing: continuous Medicaid and CHIP enrollment for ages 0 to 6. So the idea is that at any point, if your family enrolled your child in Medicaid or CHIP, that you don't have to reapply every year to be enrolled, that you would stay all the way up to 0 to 6. Because we know we've talked about this before, the first 1,000 days of a young person's life are crucial to development. And so if a family is economically unstable and they have to apply or enroll in Medicaid, let's not shake it up every year. Let's make sure that they stay and they get that support and then they grow up healthy. That's the idea. So that's a huge, this is a huge snapshot of the things we're doing to alleviate child poverty. Karen, do you want to talk about youth justice a little bit?
Yes, absolutely. I was actually a little distracted because I was getting a text from our assembly sponsor. So we have been working for, gosh, all summer. You all remember that we were one of the three. I'll back up quickly for in case somebody doesn't know. We were one of the three organizations that led the charge around raising the age of criminal responsibility here in New York. And this went into effect 5 years ago. And part of what we have always said about raise the age is that for it to be 100% functional and effective, there needed to be supports for these 16 and 17-year-olds in the communities. And as such, there has been $250 million appropriated for raise the age programming, supportive programming, wraparound programming each year since it passed, so totaling over $1 billion. Only 440 million of that has actually gotten out the door, and only in upstate New York. So we are working on a couple of fronts here. We've been working all summer and all fall, and now it's culminating in a legislative briefing that we have helped to put together for tomorrow with our assembly sponsor, the chair of the Black and Puerto Rican Caucus, Member Szilagyi, and Member Kellis. And we will be continuing our call for really opening up that spigot of dollars to flow more easily to the counties and then down on to the community organizations that are on the ground doing the actual work. So just yesterday, we've come up with a number of scenarios that the legislature, their program and council people have kind of kicked back to us and said, logistically, this just doesn't work for a number of reasons. I won't get into all the minutia there and bore you with that. So we have gone back to the drawing board several times around how do we get this money to flow where it needs to flow. And so the recent, just last night, and that's what I was getting a text about just a few minutes ago, so sorry for the distraction, is now we have created a fund. We hope to create a fund within the DCJS that would provide for flexibility in releasing dollars to those providers and counties that are attempting to do the work. And that would include, time check, yes, 14 minutes, I know. That would include, that's Brad's way of saying shut up, Karen. That would include New York City. So you'll be hearing a lot more about this around Family Empowerment Day. We have been already blanketing the Capitol on this all week this week. A team of lobbyists on behalf of this issue, myself included, have been on the ground trying to get legislators to participate in tomorrow's event. And then next week we'll be on the ground really pushing the finer points of the proposal, which we'll want to see in what are called one house bills. So the Assembly and the Senate will both put their one house bills in response to the governor's office. Little sidebar, I sent to Brad and Paige, I sent you guys this morning the notes from the Human Services hearing yesterday, and it was very raise the age focused when we got to child welfare and our friend Andy Hevesy. So sent you a lot of notes on that. I think that I covered everything on the slide. I wasn't really looking at the slide.
I know.
And there goes my phone again, so I'm mute my
Yeah, I appreciate it, Karen. So this is a lot of information. Recognize that there's a lot of important work we got to do, though, right? That's why our agenda is so broad. We're always an organization that's thinking about the bigger picture, and sometimes that means that we have to be comprehensive and intersectional and understand how these different systems interact with each other. And that's something that's very special about our organization and our network, is that we try to understand the big picture of what's going on. No single person, no family is so simple that they're only one system. Very often they connect with all these different systems, and that's why our advocacy looks this way. Um, so here we are, the press, the governor has made their opening move. They released her executive budget proposal. Now it's time for the Senate and the Assembly to respond to that. And like Karen mentioned earlier, we're already starting to see hearings. Several happened this week, where the Assembly and the Senate will more or less interrogate and prod and ask questions. Why this funding here, etc. How could this money be spent better? And we will be pushing as advocates for the Senate and Assembly leadership to include our priorities in their one house budget proposals. That's their counteroffer, is a way to think about that. And then early March, they will release their version of the one house budget proposals, what they call 3 men in a room, who it's now 2 women and 1 man in the room. So that's progress. They'll start their 3-way negotiations, and as advocates, it's our job to just keep pushing for our priorities to make sure, even if we have success getting them into the one house budget proposals, that we make sure that they stay in there and they don't fall off. Things can happen in a moment's notice at the Capitol. You think your issue is good and safe, and then it's not. So we have to be vigilant. So follow closely to our emails. We'll be picking out opportunities for all these different campaigns and ways that you can get involved. And then let's get into what we're doing as Families Together in our network to push the envelope. And so I'll pass it over to Zach. In our final minutes, we'll talk about all the great things happening for family empowerment.
Yeah, thanks, Brad. So we are happy to announce that the Family Empowerment Town Hall series is now fully scheduled. We have all 6 of our regular town halls. For those who maybe aren't in the know, when the pandemic hit, we transitioned our legislative lobby day to all online, and they took the form of these Zoom town halls, and everyone liked them so much we kept doing them, and now we're doing both. So this is the full schedule we have up here. These all stands for, so in order, it's education, developmental disabilities, addiction and recovery, mental health, child welfare, and youth justice. The registration for that is open in the link I just posted in the chat. There's a page full of information there. We're also looking for ambassadors, which is the name that we use for people who ask questions during the town hall. Each town hall has the head of the relevant state agency, the chair from the Assembly and the Senate, or at least that's what we shoot for each of these. So, for example, the mental health town hall on the 6th of March has Assemblywoman Eileen Gunther, Senator Sandra Brook, and OMH Commissioner Anne Marie Sullivan. So yeah, we're looking for people who are interested in asking questions at those town halls. If you are, feel free to get in touch with Brad or I. I've been saying this at a few different meetings now. A big emphasis this year, we're going to try to put on audience involvement as well. We've heard feedback that it's been a little bit limiting in that only the people who are on camera get to ask questions. So if there are time at these town halls, we want to try to incorporate more audience feedback and more audience questions into them this year, which we're really excited about.
Yeah, I definitely, and Zach, I'll add too, for people who maybe are camera shy or they can't make it that day or for whatever reason, but you still want to help ask questions and really help people prepare, say for the ambassadors that are going to ask the questions. We welcome, this is all hands on deck. There's plenty of opportunities to sort of influence that, including the registration itself. You can submit sample questions to us. Tell us what your ideas are. Here's some things I think you should focus on. That sorts of thing. All that's extremely helpful for us. We're going to be pulling these together almost simultaneously. All these different questions, preparing people and pulling off the town hall. So really, any help that you want to offer, any ideas you have, we're very open to hearing them and trying to find ways to incorporate them. So even if you don't want to be ambassador like Zach's talking about, there's tons of ways for you to be involved, including the day of. Sorry, Zach, just wanted to add that plug.
Sure. So all of these town halls are leading into Family Empowerment Day, which is the in-person, I like to call it the grand finale of Family Empowerment Month. Registration for that is also now open, which is very exciting. You can find that in the same link that I posted in the chat. This is on March 19th, and we are all going to come together in Albany in the legislative building. I like to think we are basically arriving at the lawmakers' front door of their office. In some cases, literally. And like Brad said, it's going to be kind of the last push, the last hurrah, so to speak, of getting our policy priorities into the final budget and enacted. Transportation is provided, as you can see here. We have routes from New York City, Watertown Central, Long Island, and we have a new route this year that starts in Buffalo. And there's pickups in Rochester and Syracuse, which we were not able to provide last year, which we are very, very excited about. Once you get there, we're going to be doing packet drop-offs to lawmakers. We're going to be doing legislative meetings with certain key lawmakers and individuals. There will be speakers, and we're gonna culminate it all in what we did last year, which was march out of the building and chanting, really making sure that those lawmakers hear our voice. So yeah, register, come along, sign up. It's going to be a lot of fun and very important.
Thanks, Zach. This is not a slide we're going to cover. Many of you might have noticed, and I think I mentioned this earlier. Hey, well, what about some of these key priorities that I care about that aren't related to funding? These are some of them, not even all of them are here. But just, like Karen mentioned earlier, right now we're just focused on the budget. And then we'll move on to the more policy and legislative heavy part of the session after April 1st. But here they are, and we'll pass these slides along to you. Here's some of our key priorities. There are more we sign on to and we're asked to sign on to new things every day. So keep an eye out for those kind of things too. But that's it. So it's all questions here. We got 4 minutes. So let's hold down the slides, and if folks have questions, comments, things they want to say, thank yous, yell at us, do it all, whatever you want to do. And I'll stop recording.